LifeSpan Digital Health is a healthcare tech company. The product is an early warning system that combines predictive analytics, self-reported assessments, and biometric data to be able to identify physicians that are at risk for burnout, and then proactively recommends interventions and tools so that they can get in front of it and before the symptoms of burnout begins. And that both impacts their individual wellness as well as the healthcare system at large.
So burnout is prevalent, very prevalent in healthcare workers, especially those that work in very stressful environments. In emergency medicine, the literature has proven that at least 50% of emergency medicine physicians and nurses are meeting the definition of clinical burnout. The negative outcomes related to burnout include medical errors. Hundreds of thousands of people die in this country related to medical errors. That's a big problem. But also just follow-up, empathy toward positive outcomes in patients are all linked to the wellness of their provider. It also gives anonymized dashboards to system administrators to know how their team, how their entire environment is performing. Right now, administrators are basically running blind how well or how burned out their team members really are.
What we've accomplished so far, because of the seed fund, it's allowed us to bring in fractional leadership, both at the financial level, the marketing, and the technology. It's allowed us to build out our development team. It's allowed us to build out our infrastructure to support the pilots that we have acquired because of that funding. So this fund is more than money. It's given us credibility. So our next steps are conducting the pilots to completion, converting those pilots to paid customers, and to go into other specialty areas outside of emergency medicine, and to move into population health management so that we can look at supporting workers in all stressful environments, not just limited to medical.
And this stress is never going away. The stressful environment will be here forever. It's the person's response and the system's response to that stress that we need to attack.
So what I'd like to say to the University of Arizona, to the Wildcat Philanthropic Seed Fund, is that you guys are not the norm. You are allowing young companies like ours to get a foothold and to navigate that valley of death. So I commend you for your efforts and for you taking care of us like we're trying to take care of physicians.